Hello everyone, and welcome. I'm excited to kick off today's presentation with episode 17. This is our first slide, so I want to start by greeting you all warmly and sharing what we're about to explore. We'll be diving into an engaging topic that I believe will be both informative and inspiring. Throughout this presentation, we'll cover key insights, important concepts, and some interesting takeaways. So let's get started and enjoy the journey together. When assessing Sree, who has a history of chronic urinary infections and is now experiencing urinary frequency and burning sensations, it's important to determine the source of the current problem. To figure out whether the issue is related to the kidneys, we need to focus on specific areas that can indicate renal involvement. One key area to assess is the suprapubic region, which is located just above the pubic bone. Discomfort or pain here often suggests a bladder or lower urinary tract problem. In contrast, if the pain or discomfort is felt in the right or left costovertebral angle, that's the area just below the rib cage on either side. That could signal a problem with the kidneys themselves. Understanding where the patient is experiencing pain helps us pinpoint whether the infection or issue is in the renal system or elsewhere along the urinary tract. This assessment is crucial because it guides our diagnosis and subsequent treatment plan, ensuring that we address the root cause appropriately. Let's take a closer look at the right or left costovertebral angle. This area is really important when we're assessing for kidney issues or other abdominal concerns. Essentially, it's the angle formed by the lower border of the 12th rib and the vertebral column. When we perform a physical exam, palpating or tapping this region can help us identify tenderness or pain that might indicate inflammation or other pathology. Remember, understanding these anatomical landmarks helps us localize problems more accurately. So, whether we're examining a patient for signs of renal colic or other conditions, knowing how to identify the right or left costovertebral angle is key to our assessment. This ties into the overall theme of clinical examination and accurate diagnosis. To determine whether a urinary problem is of renal or kidney origin, the nurse should assess for costovertebral angle tenderness. This is an important step because pain or discomfort at the right or left CVA can indicate that the kidneys are involved, such as in cases of pyelonephritis. To check for this tenderness, the nurse gently percusses over the flank area, which is located roughly at the back and sides just below the rib cage. This method helps us identify if there's any inflammation or tenderness in the kidneys. Remember, assessing CVA tenderness is a key part of understanding the source of urinary issues and guiding further diagnosis or treatment. Let's go through some key points about pain localization in urinary issues. When a patient reports pain at the urinary meatus, that often suggests urethritis, which is inflammation of the urethra. It's a common site for irritation or infection, so pinpointing pain here helps us narrow down the diagnosis. If the pain is at the labium, that typically indicates local genital irritation or infection. This could be due to conditions like vulvitis or other localized issues, and it's important to consider the area's sensitivity to pinpoint the problem. Now, pain in the suprapubic area usually suggests bladder involvement, such as cystitis. This is where the bladder itself becomes inflamed or infected, and patients often describe a dull, aching discomfort in this region. So why not the others? Well, pain in different regions can be misleading or less specific for certain conditions. For example, pain outside these areas might be due to other causes, but focusing on these key sites helps us directly target the suspected underlying issue. Overall, understanding where the pain is helps us differentiate between urethritis, local genital infections, and bladder problems, guiding us towards the right diagnosis and treatment. Let's wrap up with some key nursing exam tips regarding urinary tract infections. When a patient has a kidney infection, you'll often notice flank pain or tenderness in the costovertebral angle, which is basically the area around your back near the ribs. This is a crucial sign to recognize because it indicates the infection has reached the kidneys. On the other hand, if the infection is limited to the bladder, the patient usually experiences suprapubic pain. That's discomfort just above the pubic bone. Now, these distinctions are important because they help guide your assessment and management. Remember, during your exam, always compare these signs and symptoms to your overall clinical picture. Recognizing where the pain is localized can help you differentiate between a bladder and a kidney infection. So keep these key points in mind. Flank pain and CVA tenderness point to kidney involvement, while suprapubic pain suggests a bladder infection. This understanding is essential not just for passing your exam, but for providing effective patient care.